Hello, my name is Alexis Wells, an undergraduate student at Norfolk State University, working alongside Dr. Audrey Douglas-Cooke. Our poster examines how social determinants of health influences access to heart transplantation in Virginia. Heart transplantation saves lives, but access is not equal for all patients. Social determinants of health, such as income, education, insurance coverage, neighborhood environment, and healthcare access, strongly influence who gets referred, evaluated, and listed. Financial hardship, transportation barriers, and limited local resources can delay or prevent care. Addressing disparities requires looking beyond clinical criteria to these broader structural barriers. This study examines whether uninsured or Medicaid insured patients from Norfolk are disproportionately referred to a regional safety net center, VCU Health, Richmond, instead of being evaluated or listed locally at Sentara Norfolk. The goal was to quantify center-level differences in transplant volume and payer mix, identify structural drivers of inequitable access, and propose social determinants of health informed strategies to improve equity in cardiac care. We utilized OPTM UNOS data from 2015 to 2025 to evaluate transplant volumes, demographics, and payer mix. Our analysis focused on key variables including age, sex, race and ethnicity, and insurance status. Importantly, our approach centers on systemic and structural factors rather than individual blame. By analyzing institutional patterns and broader barriers, we aim to better understand how inequities in access develop across transplant continuum. Let's explore the racial and age distribution patterns at Sentara and VCU. These key results highlight important disparities in transplant access. As you can see, at VCU Pauley Heart Center, the racial and ethnic distribution shows a substantial proportion of Black and white patients with smaller representation among Hispanic and Asian populations. Additionally, Medicaid and uninsured patients make up approximately 20% at VCU compared to about 5% at Sentara. Now let's examine racial and age patterns at Sentara. Although Norfolk has a higher cardiovascular disease burden, transplant volume remains lower locally. Black recipients represent the largest racial group, with most transplants occurring in the 50 to 64 age range. Between 2015 and 2025, Sentara performed 221 transplants compared to VCU's 330. These differences raise important questions about referral patterns and institutional roles in transplant access. Building on our demographic and insurance findings, this next visual shifts our focus to transplant volume trends over time, helping us see how disparities may translate into differences in where patients ultimately receive care. While these findings reveal important disparities, several limitations remain. Medicaid and uninsured data are not publicly disaggregated by center in OPTM reports, restricting precise comparisons. We also lack referral source data such as free clinics versus private cardiology practices. And finally, because this analysis focuses on Virginia and heart transplantation, the results may not generalize to other states or organ systems. Building on these limitations, we recommend clear, actionable steps. First, standardize and increase transparency in transplant eligibility and financial screening to reduce gatekeeping. Second, expand Medicaid outreach and strengthen referral partnerships with community clinics to improve access. And finally, invest in local transplant capacity and support IRB approved patient level research to validate referral patterns and advance equity. Thank you for your time and attention. Addressing disparities in heart transplant access requires data, transparency, and collective action. And I appreciate the opportunity to share this important work with you today. We welcome any questions or comments that you may have at this time.